That right there.
That's
That's why. That's why.
Hi, good afternoon. We are live at our resolutions open house. Um, and so some of y'all have been wanting to speak with our psychiatric mental health nurse practitioner, and she's here today. She's gonna be speaking to you in just a minute. We'll be here till about 2 o'clock. So if you want to come and grab a bite, please do so. We have lots of gift prizes or door prizes. And don't forget to like, share, and ask your questions.
And the best cheese ball in town.
So Mayor Marshall says it's the best cheese ball in town. As you let me know when you are ready, and I will move out of the way.
What am I to do?
Well, we're gonna ask you questions.
Here, I'll take it.
Thank you. LaFonda had the first question. Can you?
You may take yours too. You're all finished. Anybody else finished? You want me to take yours?
It's okay.
Oh. Well, I was a waitress for a long time, so I'm trained. Sir?
You want to go ahead and answer the first question that you remember?
Sure. All right. So our first question came from one of our previous Monday night mental health Monday sessions, and someone wanted to know how they could go about weaning themselves off of Adderall.
Okay. Adderall is one of a class of medications that's a Schedule II controlled substance. There's really no reason to have to wean off. You could just stop it. You're not going to have any withdrawals or intolerable side effects or anything like that. The way that it works, typically for ADHD, you take it, you notice an improvement in your symptoms within an hour or so, versus different type of medication.
Hang on,
So-
Liz. Even though it's showing up, it's sideways on the screen. So I can hear you, but you look strange.
Okay, it's fixed.
Okay.
It's working. Okay.
Okay.
So you take it, you get the benefits. You don't take it, then you don't get benefits. So you can just stop it without risking any withdrawal symptoms or anything like that.
So what would you say to people who have concerns about taking medication for, say, depression or anxiety, because they go online and they look at all of these side effects, and they may be afraid to try?
Mm-hmm. Well, you always have to look at risks and benefits of both treatment with medicines and without. And we typically recommend medication when the benefits of it are far greater than any of the potential risks. There, of course, all the medicines have possible side effects. Again, it does not mean that that's going to happen. It's just one of those things that you have to try, and then you kind of see if it's going to work or not. Even if you were to have side effects, there's lots of different alternatives, options that we could do to help you with the symptoms.
And so, in your experience, how often have you seen like those extreme side effects from people taking psychiatric medication?
It just depends. Some people tolerate medicines really well and never have any side effects. Some a little bit more sensitive to medicines, and they might have more side effects than somebody else. But that's the reason why it's important to continue and to follow any recommendations, especially as far as appointments go, because it's just not that simple. With the medicine, sometimes it takes us a little bit to get it right.
So how would you?
Mm-hmm. You know, some people were asking about Xanax
Mm-hmm.
and its use for anxiety.
Mm-hmm.
And I know you have a really strong opinion about that. You
Mm-hmm.
want to educate us?
Okay, Xanax. So there's no good or bad medicine. Okay, there are some medicines that have more risk involved with them than others. I don't typically go to a Xanax first because usually there's lots more going on than just anxiety. Um, then you have to look at what type of medicine it is. It does carry risk of abuse, of dependency. Um, it is for anxiety, but it can worsen anxiety for some people. And it's one of those medicines that you have to take consistently. If you're on a certain dose, especially the higher doses for a long time, it's one of those that you can't just completely stop um, because of the possible withdrawals, including even death. I mean, you can have seizures, you can have um, difficulties just coming off of it. And so here it is, you have another problem added to what you already came in with. So there's lots of other medications that are a lot safer, and that's typically what I recommend.
And she always tells us that it's, trial and error. You got to try it for a little while. It may not work. Generally, when she starts somebody on medicine, you'll have them come back in 2 weeks or maybe the next week, depending on what it
Yeah.
is. So she monitors them really closely. And our philosophy here is if you are taking medicine, you must be seen by a therapist because if you have a crisis in the middle of the night, she's not going to answer the phone. We are. And we need to know what's going on with you. So, yeah. Anybody in the room have a question?
What age do y'all start seeing patients?
Ooh. I think the youngest we have 6, but Allison really is the only one who sees another. Well, David might. Where's David? David.
Yes.
What's the youngest that you'll see?
Probably 5. I had a preschool before that was 4, but usually 5.
Because really, you're supposed to have like a special certification to see them any younger than that, especially if they're on Medicaid. So yeah. We really had a long waiting list at one point in time. Right now, we're at about a 2-week turnaround. If the client or potential client fills out their paperwork, gets everything done, then we try to get you seen within 2 weeks so you can start your process. Because we realize like it's a big step for you to say, hey, I want to come and see somebody, and so we don't want you waiting for a really long time. So
I have another question for Liz. So she has something to say. So before you leave, Liz, can you just quickly speak to like some of the misconceptions about medication when it comes to mental health? Maybe some of the misconceptions that you've seen and how to overcome them.
One of the biggest things that I see is people want to really rely on medication, and that's all. And even though that's what I do, is the medicine. Medicine, I always teach my patients that medicine is only there to help. It is not a fix or a cure. Um, a very important component of treatment is not just medicine, but it's a combination of different things. It's making sure that your medical is stable, making sure that you're doing therapy, with it. You're eating a healthy diet, lots of water, exercise. It's a combination. You can't treat mental and not and just fix everything. It's just not going to work that way. So we treat you as a whole. Medicine is just one of those components. It is not a fix or a cure for everything. I'm all about the least amount of medicines, the lowest dose, that's going to control someone's symptoms, but also allow them to have a good quality of life.
Well, thank you for answering our
thank you.
questions. I really appreciate it. We are gonna let her go because she has a schedule.
Thank you so much.
Are you local here?